Question number 1. Hey, Dr. Islam, is something wrong if I have accidents when I'm an adult? Very common question. I'm actually glad we're talking about this because we're actually talking about what's called fecal incontinence. This is a very common problem that a lot of people have, and more importantly, a lot of people are suffering from, and they don't let us know. When you look at the trials and clinical studies about people who have fecal incontinence, a lot of the patients who suffer from this don't actually want to talk to their doctor about this because they're embarrassed. We have to make the initiative to ask about how your bowels are doing. And it's a very common problem, especially as we get older. So why does it occur? Mainly it occurs because the muscles in your bottom are not working correctly. They may not be having the right tone. They may not be having the right function. There may be medications that could be on that could be triggering that as well. Our rectum is actually made to hold solid stool. So if you have liquid stool that's there, it's going to seep out and more difficult to hold in. But in addition to that, your rectum muscles are mainly going to be contracted, and that's going to be a reason why you keep stool in there as well. So if you don't have good muscle tone, that can cause accidents to occur, which is why people have to wear diapers. So what can be done about this? So number 1, we have medical therapies that help out with that. Sometimes we use medications like Imodium or Lomotil to help slow down the bowels, or help out with the muscle as well. Sometimes we'll do pelvic floor therapy, where we actually train the muscles to allow it to work more effectively and more consistently. Sometimes we'll change your diet by avoiding things like dairy. Maybe we'll put you on what's called a low FODMAP diet. Maybe we'll remove some of the supplements you may be taking that could be causing bowel issues, like magnesium or laxatives or medications like that. But sometimes we don't have good medical options. We have to resort to surgery. There are surgical options to help improve the muscles and to help out what's going on. And sometimes we don't have good options, so we have to resort to things like diapers. And this is sometimes an embarrassing thing that a lot of people have to suffer from as well. But we know that this is a very common problem. And if you are suffering from accidents and you're having issues with this, come see somebody like me who can help to at least diagnose what's going on and potentially treat what's going on to help out with your bowel issues. Great question.